Hello, everyone. My name is Steve Petty. I'm the president and CEO of the Lynn Institute. We have a great discussion today with three esteemed pastors that are our partners in Northeast Oklahoma City. I'd like to introduce Pastor Ray Douglas with Greater Mount Olive Baptist Church, Pastor Jeff Mitchell with Tabitha Baptist Church, and Pastor John Reed with Fairview Missionary Baptist Church. Thank you all for being here this morning and for the conversation that we're about to have. First of all, Pastor Reed, I'm going to kick it off to you. Could you tell us in your thoughts why the African American community is a little more hesitant about the COVID vaccine? There's a lot going on out there in the media. We're seeing a lot nationally where people of color are a little more hesitant to go and get the vaccine. Can you tell us your thoughts on that?
Well, that's not really hard to understand. Really, it's a matter of a trust factor. As we all know that for most of all of our lives that we have had to deal with the matter of inequality here in our nation as African Americans, Black, or whatever, however we want to refer to ourselves. And so I think it's so many times, we've had to deal with it, and of course. So anything that comes up, it's a matter of not trusting the system because the system has not treated us fair for all of our lives. And so right now, even with the matter of administering the vaccinations and all. That we've come to find out that that Black folk, the African Americans, are most certainly been left out when it comes to the proportion of more whites receiving them than Blacks right now. And so, that's all the way through our society, and we understand that. So when everything happens, and for we don't trust that we have don't trust the people who are responsible for really making the decisions and all to govern us here in America and all. We have distrust for them. I know I do, and I'm not. And so I think that's the problem. I think overall that, and I don't know what the numbers are, but I think overall that it's really a small percentage of African Americans that really are not trusting the matter of taking the vaccinations.
Gotcha.
Pastor Douglas, I'd love to ask you a question next. As you think about the vaccine, if you haven't, do you plan on getting vaccinated? And if so, what are your thoughts? What do you think has gone into your decision making as you've kind of thought on that?
Definitely plan on getting the vaccine as soon as I'm eligible for it. I think to kind of talk about what Dr. Reed has said, there is some distrust in the African American community with medicine and government, and rightly so, based on the history that has happened in our country. But I look at the vaccine on this wise: we're like the lepers at the gate. I think people are concerned. It was a quick vaccine. It was. A lot of people think it was rushed to market really quickly. But what we do know is that people are dying from COVID-19, and where we are is in a tough position. So we're like the lepers at the gate. We can't go back. We can't stay here. And so the vaccine offers some type of hope. Of course, ultimately, our hope is in God. But we prayed that the Lord would send something. And so I believe that the fact that we have a vaccine now is God answering our prayer. I'm thankful for the research and the scientists and medicine, but I believe that it got to market quickly because God allowed it to. So yes, I'm going to take it, and as soon as I can, and I'm going to trust that it will help me not be sick from the COVID-19.
Right. Pastor
Let
Mitchell,
me
what about you?
let me say
Yes, sir.
let me say what Pastor Douglas have said. I've already had mine,
Okay.
and looking forward to the second one on the 3rd of February.
So have you
Didn't have
had
any
any
problem.
no problems?
No
That's what I
problem
was
at
going to
all.
ask. Yeah.
My arm didn't get sore.
Mm.
I know that I've talked to some people who had some soreness in their arm. I had mine in my right arm because I'm left-handed, and but I haven't had any problem whatsoever. And I'm looking forward to the second one. I was involved yesterday at the Ebenezer Church where we gave out over 1,100 of vaccination on yesterday, and I talked to so many of those people who were coming through the line on yesterday who were just excited as they could be that they were able to get their shots, and so I think that I know that without a shadow of a doubt that I'd rather have the shot than be experienced. And so far, I haven't experienced, catching the COVID-19. Some members of my family, as a matter of fact, my daughter and son right now suffering with it. My grandson had been suffering with it, and a major part of my family. And of course, as you know, I'm the oldest one in the family, so thank the Lord I haven't had said yet. And right now, I've had the vaccination, so I think they're saying is I'm 85%. But the second one means that I'm 95% that I won't get it. So I'm excited. I'm happy that I've had the privilege of getting the vaccine, and I would recommend to everybody to get it.
How about you, Pastor Mitchell? What's your experience? Have you have been vaccinated yet?
Yes, I've had the first vaccination. My wife and I had I think it was about last week. Now I did experience a little bit of soreness, but I would recommend it to everyone, especially in our culture on our side of town, because of the fact that it can't do anything but help you. I too. Our family at the same time, mind you, experienced having that the COVID-19. It was my wife, myself, and my son and daughter. We all had it at the same time back in November, and it's nothing that you really want to have to endure. And so for me, it's an opportunity to at least lessen the chances, even if it doesn't do what all they said it can do. I think it gives me a better opportunity to remain safe, and so that it does not cause, take us to the brink, as it were. But I'm all for it, and I would encourage, along with Pastor Douglas and Pastor Reed, our community to be involved, and I think they are. I think, as Pastor Reed said, there are just there's a small amount of people, and there are some people who speak loudly that say they're not going to take the vaccination, and or they're saying the other thing they're saying is, well, let's wait and see. We're just going to wait and see. We're going to wait and see if nothing catastrophic happens to those people who've taken it. But I would encourage all who can to get involved in taking the vaccination, and I'm looking forward to taking my second one. I am.
Pastors, I'm curious to know if you've had the opportunity to talk to anyone who may have been apprehensive or had fears and decided to get it, or if you've had any conversations that have led to folks who were on the fence or weren't quite sure that have gone on to get the vaccine.
Well,
Me?
Yeah.
Go ahead.
Yeah,
Go ahead, Pastor
Pastor.
Mitchell.
No,
I've talked to some people who early on were adamant not going to get a vaccination because of the concerns they had. And I think part of it is education. And I think the more information they receive, they told me that whenever they were eligible, they were going to take it. And at this point, because I think that some of their fears were calmed because of the education. And I think that's one of the major roadblocks. I talked to some people yesterday from some epidemiologists and some other people from the health department about the concerns and what was happening in our communities, not just in Oklahoma City, but around the state. And one of the roadblocks, I think, is the education, getting information out through the vehicles that we're able to educate people, to tell them about the vaccine, let them know what to expect as far as side effects, let them know that every vaccine is going to have a side effect. And then the other thing is that having the availability. I think that's a big concern. Some of the people that I know that have taken it, I've had to go to places like Ardmore and Enid, Durant, to get a vaccine. And so I think that is probably the biggest impediment, is the availability in our communities, not just in Oklahoma City, but in our communities all over the state.
Right.
So,
Pastor
but I
Reed,
think they want to, and the more we can educate them about the necessity of it, the moral issue really of
exactly.
it as the faith community is that just like wearing a mask is a way to love our neighbors, getting a vaccine will be a way to love our neighbors and show the love of Christ and not get people sick.
Right. Pastor Reed, we can only see the top of your head. Can you push your camera up? There's your face. All right, sir. There we go. We wanted to see your face.
All
Sir,
right, no problem at all.
Thank you. What about in your churches when you're up there? Are you continuing to, those of you that have probably, you're doing virtual services, but also maybe small groups. I'm assuming you are all continuing to talk about the importance, like Pastor Douglas said, of masks and washing your hands and such. Is that something that every service and every opportunity you were all promoting that type of education to the community?
Oh yeah, we're doing that every week. Now, naturally, we virtual now, and of course, I usually make a statement, or either the assistant pastor of our church usually make a statement to our people every Sunday, and I think it's also as a matter of our people, African American people having trust and confidence in their own leadership, their own leaders, and of course, as pastors, we are leaders in our particular congregations, and of course, it's important for us to constantly remind our people of the importance of the vaccine. And of course, we've had so many people who have been victimized by the virus, and so many people have experienced the death of their loved ones, and so much sorrow and so much bereavement has been experienced among our people, and of course, and so many of even across our nation, people that we know, pastors that I've known for over the years, and all have been victimized by it and this type of thing. And so it's important for us as pastors in the faith community to continue to remind our people, and naturally we are concerned. We want them to stay well, and so we and of course, even the few that we have coming to the sanctuary on Sunday, we make sure that it's safe for them that we maintain the masses, we take temperatures, we do all of that. We don't allow anybody in without a mask and all of this. So because we know there's a seriousness of this virus, and we know it's not anything to play with. It's a reality that people are dying every day. And here in Oklahoma, I think the last few days, the cases are sort of come down, and the hospitalizations are sort of decreasing, and we hope that will continue. And the more people that we get vaccinated and all of that, we're hoping that will continue for the next 4 or 5 months, so we can get back to our regular routine of living. But it's important, as you said, that we keep reminding our people, because sometimes it's just some people just don't listen. It's no question about it. It makes no difference about how much you remind them and all. Some people just won't listen, and so that's something we can't worry about. We do what we possibly can to help in every way we can. I was talking to one of my members the other day that won't take the shot, and I'm continuing talking with her about it. And she told me she won't take that shot. She does not take flu shots or anything. So, we have those folk, even with my conversations, that, well, the Lord's gonna take care of me anyway. But you know, they don't understand, as Pastor Douglas was talking about, the educational part of the thing. That the sciences and all of those folk are part of the Lord's for people too. That's working towards a vaccine and getting a vaccine. No matter how quick it was, we still had a vaccine. And I don't know about the rest of them, but I'm concerned about staying around here as long as I possibly can. I'm facing our 83rd birthday in March, and I'm not in no hurry to get away from here. So I want to do my part, and I want to do my part to take care of myself. And so that's why I'm so hurrying, rushing, and waiting to get my vaccine.
Right.
Yeah.
Pastor, I heard you mention the leadership. And so as you talk about your congregation and the example you gave of the lady who's not on board, could you talk about the importance overall for leaders to really set the tone, and that, if setting that tone is really going to steer the folks that are looking to you for leadership. So what would you say to leaders, or what would you stress to those in the community about wanting to really promote?
Well, in the African American community, in the faith community, the pastors have been the leaders for over the years in the African American community, and that's still so. That they look up to us as their leaders, and they have faith and confidence in us that we're going to lead them in the right direction. From a spiritual standpoint, we are the conscience of the community. African American pastors are the conscience of their community, and maybe it's not 100%, no, but we are the conscience of the community. So they look up to us to lead them in the right direction, and so that's what we do. That's that we serve our community. We serve our people. We serve our congregation. And from economic standpoint, from an educational standpoint, from a political standpoint, they look up to us for us to advise them in the direction that they should go and they should take. And we continue to do that. We're doing that. African American pastors are doing that all over this nation right now.
Right.
Concerning this COVID-19, we can't be on campus in our pulpit, but you have more African American preachers right now on online, on Facebook, and on YouTube across this nation as you've ever seen before.
Right.
And we are keeping our people connected on whatever subject we think that we're led to do. That's what we are doing. And so we're still giving leadership, although they're not on the campus, we're still giving leadership to our people wherever they are. And so I think this is one thing that's important for this vaccine and all, that African American pastors take their leadership role in their own environment and help to lead their people in the right direction to stay healthy.
Right.
There
And
was a
Pastor,
very interesting article in Word and Way magazine. Word and Way magazine is put out by some Baptists in Missouri, but it talked about how clergy can help in the pandemic by promoting the vaccine. And it again, it comes up with being able to partner with, we're pastors, theologians, and preachers. We're not scientists, but we have to partner with people in whatever area to be able to provide factual information to our people. But as the church goes, as Dr. Reed stated, as the church goes the community, and so the voices from the pulpit. And even now, the voices from Facebook of these pastors that are leaders in the community, even for people who are not members of the churches, as the African American community goes, is following the lead of the church.
right.
And so, if we are not the leaders in promoting it, I don't think it will. No one else has that influence collectively.
Right.
Not even the entertainers, not everyone that people are looking to. They don't have the influence that the pulpit has in the church.
Yeah.
Dr. Reed can say some things in Oklahoma City that people will listen to that the mayor is not able to say in Northeast Oklahoma City.
Right.
I can say some things at my church that people are listening to and following that the governor in a decree won't be able to. And so there's influence. And so we have to have the partnerships and resources that we can be with our influence, that we can use it for the greatest good for our people. And so we can help that if people are partnering with us and not circumventing what we're trying to do.
Pastor Mitchell, we've been talking about the pastors. What in Northeast? What in your opinion? There's I think 105 churches that we at least. So there's a lot of different religions and a lot of different pastors or leaderships in those churches. What is your opinion as far as what's going on in Northeast Oklahoma City with those leaders? Are you seeing the same type of, you three seem to be on the same page as far as getting vaccinated. Are you seeing that with your colleagues in other churches that they're saying the same thing? Or is there any, issues with other churches that aren't agreeing the way you three are?
No, I think all the way across the board in Northeast Oklahoma City, at least I've not encountered any pastors on that in the Northeast quadrant who have taken I did encounter one, but it's not widespread. Most of them, as Pastor Reed and Pastor Douglas has said, are concerned about their people, and they understand it's beyond them. It's beyond just what my own personal view is. We're concerned about the people that we give leadership to. We're concerned about the entire community, whether they are part of our particular churches or not. And so many of the pastors are in a stance where we need to do this together and to show the people of God, the people that are in the community, that we are in solidarity with this particular vaccine, and to do it and so that we can move toward getting to a better place. I think that the trust issue is real, and I think that it is raw for those who do distrust, and I think they do look to us to try and eliminate as much of the problem as they possibly can. And again, you won't get 100%, but I think the majority of them are will be willing to follow, especially those who are on the line. If they can see that we are in agreement, and I think they do, if they can see that and sense that, then I think that they're more willing to be involved, and not only just to take our older members, but I think the other issue that we may not have talked about is this millennial group. And even though they're not the ones who are at the highest risk, that is where we're finding that there's a lot of people who feel like this is a hoax. That's the word they use. This is a hoax. It's not real. That group of 30 and under, a lot of them are just not influenced by it to the degree. And so we're able to even try and at least that must be our goal, to reach those kinds of young people as well. I do know that of course the need is great for those who are 65 and up, but there's also been a movement of late of the younger people who are kind of getting sick, and so we do have to again educate, and from the youngest to the oldest. But we are certainly responsible, I feel like, as a moral issue and a spiritual issue, to lead them beyond ourselves to what is better for everyone. So that's what I've been able to conclude. Yeah.
Pastor, you all have mentioned and discussed the real fear associated with the historical traumas associated with vaccines and components related to medicine. And so to someone who has a fear, a legitimate fear associated with the historical issues that have happened, how would you approach trying to get them to reconsider the vaccine? Because when we look at these fears, they're legitimate, right? Historically, they're legitimate. How do we look forward with this pandemic and this vaccine and try to help with the education component as far as it relates to this pandemic?
Well, I think that, and of course, I know that Pastor Douglas and Pastor Mitchell has the same. We have health ministries in our church, and of course, I have the director of my health ministry, who is also the dean of nurses at Langston University. And Pastor Douglas mentioned about the educational part and all of that kind of stuff. Although I'm not familiar with a whole lot of the figures and all of that type of stuff. I have a health ministry, and so we know how to refer, and I refer them to my health ministry, and whatever questions they might have, if they don't have the answer, they'll find the answer. And I think that's the important thing, as Pastor Douglas mentioned, is the educational part about it, about the vaccine and all of that type of stuff. And of course, we understand and know we even have African American people who are involved in the finding of the vaccine. I mean, that was involved in it. And so we wanted to inform our people that it wasn't only just the white people and all that was involved in as far as the scientists and all. We have some outstanding African American scientists too, and African American health professionals that are involved up front with the vaccine. And I think our people need to know that too. And so my thing is to do what I possibly can to with all the statistics and everything to really to educate my congregation about all of it. And of course, I have people in my part of my congregation who has the information.
Right. And then also there are town halls and resources that are available that
Right.
we are participating in, and linking our congregants and then those who follow us and social media to get the information concerning it. But to Anthony, to answer your question, I think that very legitimate concern that people have, that the government is trying to put something in you in a vaccine, kind of tongue in cheek, I asked them, do they eat the food? And so, yeah, I think there are better ways of administering something than a shot. So food, the water, all of that stuff, if
Yeah.
they were trying to get you, then they would be able to get you that way. And again, what we have to do is trust God. And so the thing is that if the Lord presents for us a solution, I think that our faith dictates that we take the solution that the Lord has made available for us. And I'm looking at our, as Pastor Mitchell said, our spiritual responsibility, our moral responsibility is to do whatever we can to keep people healthy. And so if the vaccine is going to help save lives, then we have to be pro-vaccine.
Right. And we've talked about education, and as you three know, we've worked with you and in your community for over 5 years. Education, we believe, is the key, and trying to enhance what you all are doing. Other community members, that's what Lynn is trying to do, is do these type of virtual visits that we can put out and let the community know. What other thoughts do you have as we kind of wrap this up? Is there anything else that we should be doing to work on educating the community about the reasons we need to get this? Any other thoughts?
Well, I think you're doing a tremendous job. All we, it's a matter of educating our people, and then also it's a matter of doing what we possibly can to help get the vaccine for our people. This is the important thing, and that's what we had. We had the vaccine in the community on yesterday, and we're working towards doing it again on next month. Our concern is we had so many people, and probably Pastor Douglas and Pastor Mitchell probably still have parishioners, and I have some that's 65 and over who have not had the opportunity, and they're having a problem getting their names on the list and all of this type of thing. And so that's the one problem that we're experiencing in the community right now, and in our various congregation, getting all of our people vaccinated. And they are apprehensive about it. They're concerned about it. They're working hard trying to get their names on the list and all. And they told they turned down, told to call back tomorrow, or call back, or keep calling, and all of that all of these type of things are happening right now. And of course, I know we've had a change of administration in Washington, and we hope that will help more in the future than it has in the past. We're looking forward to that. But I think all of us as in community leaders, that's one of my big concerns now is getting my people vaccinated, because I know it was an article in the Oklahoma City and in the Daily Oklahoman here about a week or more or so that showed us that in proportion that the whites were getting more shots faster, much faster than African Americans. And I visited out to Integra Hospital that used to be Deaconess Hospital on last week, and I noticed that in that whole line of the people who were getting vaccinated out there, I only saw about one or two blacks. And like I said, I'm not blaming anybody, but there is a problem somewhere.
Right.
And
If
so
we could get vaccinations for the people in our community that want a vaccination, those outliers that we're talking about, how to bring them in and have them vaccination, I think that would help, because then more people would be able to talk about it, like Dr. Reed has, and Pastor Mitchell has said that I've gotten it and there's no ill effects, and
Right.
that will allow the confidence to happen. And so right now, people are talking, it's a theory of whether or not the vaccine, because they're not available. So I think the biggest roadblock and the thing that is stopping, I guess, the acceptance of it. Pastor Reed talked about this member that was anti-vaccine. I can almost bet you that as more people in the Fairview church get a vaccine, that person will come around.
Mhm.
yeah. Well, I think that what we did yesterday was tremendous, and Pastor Scobie over at Ebenezer was directly in contact, with the health professionals, and we were able to get that accomplished, and we're looking forward to, like I said, another one after the 1st of February. This is the type of thing that we're concerned. I'm concerned about, of course, Northeast Oklahoma City is where I've ministered for 58 years. I'm concerned about the people. I want the best for our community, always has and always will work towards that end. I love the entire city and the entire state. I was born here, been here all of my life. But where I serve is the Northeast community of Oklahoma City. And I want to see, I always want the best for that particular community. And so we're gonna work hard to see that. And if any way that you all can help with that concern, we're going to work hard to see that all of the people in of Northeast Oklahoma City, those 65 and over, and even when we get to the lower age, to get all of those people vaccinated as soon as we possibly can.
Right.
And
That's,
we want equality. Listen, let me say this to you all.
yes, sir.
That's the only thing that Pastor Reed is concerned about. I'm concerned about equality. I'm concerned about equality, and I think that we are equal, and everything that we do in our city ought to be worked around being equality. That all of us are citizens of this city and this state, and we should be equal. Now, I know that we still, let me say it like this: we are not yet, but we ought to be working towards that end, doing everything we can to be concerned about all of our citizens.
Right. And I know that, we've worked with the health department like you gentlemen have as well. And that has been an issue that they've addressed to us, is stating, trying to get minority communities in there. So we need to do a better job, all of us working with our healthcare partners, to let everyone in the community know when these different clinics are available in Northeast Oklahoma City. And I'm assuming that when those are available and you guys hear about them, you are letting the people know during your church services. And that's something that the Lynn Institute is also trying to do, is when we're out, we're trying to promote those online, or if we're at an event, handing out flyers. I know the health department, the local health department, city, county, Centennial Health, Perry Clausen, Mary Mahoney, and a lot of our health systems are doing these clinics. And we've reached out to them on many occasions and tried to let them make sure that they know that we're going to help any way we can promote that in the African-American community and beyond. So that's another thing, just educating about locations, finding out why, if there is an issue with vaccine supplies, which we know there is nationally, and at least educating people to say, look, this is the issue. We will get it to the community as soon as it's available. Do you agree that's kind of happening, or needs to be increased? What's your thoughts on that?
Well, I think it should be increased.
Right.
I personally think that, because my concern is that I'm always concerned about the equality part of it.
Sure.
That we are getting our fair share. And at the present time, the article in the Daily Oklahoma stated that we weren't.
Nah.
Okay.
Yeah, and I think the concern I have, again, is the equity issue, and so you can tell people what to do, but it's like telling someone to go to the store, and they get to the store and what they need is out of stock.
Yeah.
And so that's the issue, is the availability. The biggest issue is the availability issue, that, and the disparity that happens. Like I said, not everybody is able to travel across the state.
Sure.
Again, as far as Durant,
Yeah.
people have gone to be able to get it, and so that shows that they were concerned and they really wanted it. So Durant, Enid, Ardmore, people are going to be able to have that, and so we need to have it to be equitable, that the availability
Right.
is, and so and not have the disparity that some people have this allotment and other people
Sure.
have
Right.
another
And
allotment.
And as those new advocating, right, when those new shipments come in,
Right.
how do
Right.
we ensure that large percentages of those are able to affect the minority and Black community? And so I know I can speak for Lynn in that, well, we want to see that happen. We want to make sure that Northeast Oklahoma City and areas around that serve minority populations, that the supplies are getting into the community. So we're right there with you. We want to see this equity. We want to see things like yesterday happen on a much more frequent occurrence, because at the end of the day, you know, Pastor Douglas, to your point, you know, we can tell you where to go, but if, you know, we tell you where to go and there's not enough there for you to get it, you know, how can we make that happen? So we too want to greatly see that happen. And I know we're going to continue to advocate with our local partners and partners at the state level to try to see what we can do to get more vaccine as it becomes available into the arms of folks in Northeast Oklahoma City.
Exactly. Exactly. Well, continuing to do these type of virtual chats with members of the community and is, I believe, a great way to educate, and we will make sure that this information gets out. I want to thank each of you for taking time to talk about this very, very serious situation. I think you've given us all a lot to think about, a lot to consider, and the education piece, the supply piece, those are issues that need to be addressed, and we will look into those as well. And I know you all are visiting with your colleagues as well in the clinical and healthcare profession. So working together to help make this happen is what Lynn, the Lynn Institute is that's our goal. That's our mission, is really finding ways that we can bridge those gaps in education, services, health access in all of those areas. So I want to thank all three of you for your time.
Thank you for
Pastor Douglas,
allowing us.
Pastor Mitchell, Pastor Reed, thank you all. And we will do this again soon. Thank you all for watching. And if you have any other questions, please contact us at the Lynn Institute.
Let me say,
Yes, sir.
I appreciate you all so much, and most certainly I appreciate spending time with, as you may not know, both of these gentlemen, both of these young men, my sons in the ministry.
Aha, you probably have stories too. You
Both
could tell,
of them,
right?
and let me say like this, I'm a proud pops.
There you go. That's a good.
I really appreciate the time just spending time with them, and with them, and listen to them as they talk and everything. And I'm so proud of both of them. I don't know what to do, and so I'm just grateful for their ministries here in the community, and they are doing a tremendous job here in the community and becoming leaders and furnishing leadership in the African American community, you know. And I've been here and done that and all of that type of stuff. And of course, I'm not in no hurry to go nowhere, but you know, nobody can go on forever. And if I had to leave, and if I had to leave right now, I'm satisfied in knowing that our Northeast community is in good hands.
I
And so
agree.
I appreciate you all so much. Yeah.
Well, and thank you all for allowing us to come into your community and assist. So we're just very blessed, and thank you very much for your time.
God bless you. God bless you.
You all.
Thank you.
So much.
God bless you.
Bye.
Be well.